fingers through your hair. Okay, and I'm gonna look for blood on my gloves, okay? Now, usually we can tell if there's like a bump back there. Usually if you're bleeding, there'll be a bump associated with it, okay? Sometimes you can feel the blood on your hands, but you're wearing gloves, you may not, so you look, okay? All right, so now I'm gonna check your forehead, your nose, your orbits. I'm gonna check your cheekbones. I'm gonna check your upper jaw. I'm gonna check your lower jaw. I'm going to open your eyes and shine a light in your eyes and check your pupils. I'm gonna take my flashlight, I'm gonna look up your nose. And if I haven't already done it when I looked at your airway, I'm gonna look in your mouth and see if I find anything. I'm gonna look in your ear for blood or fluid, and I'm gonna look behind your ear for a bruise.
Sorry.
And do the same on the other side. Okay, that's the head. Now, you're a conscious patient, so do you feel, does it hurt when it palpates your neck?
No.
Okay. I'm gonna look for jugular vein distension, and you can see that she has mild jugular vein distension. You can see that that's a jugular vein right there. Okay? It's normal to have a jugular vein when you're supine. Okay? Check the trachea, make sure it's in the middle. Okay? I'm gonna palpate behind her back, her upper shoulders, no blood. I'm gonna check her clavicles. Okay? Since she's a lady, I'm going to press her upper chest, press her lower chest. Does your chest hurt when I push?
What?
Does your chest hurt when I push?
No.
How about when I do that?
No.
Take a deep breath. Does it hurt when I do that?
No.
Okay. Now I'm going to take my stethoscope and I'm going to listen. Open your mouth, take a deep breath. And out. Deep breath. Out. Deep breath. Out. Deep breath. Out. Okay. Now I'm going to palpate the 4 quadrants of the abdomen, looking for tenderness or distension. I'm going to find the hip bones. I'm going to push down. I'm going to squeeze in. If there's any sign to the genitalia, I'll inspect the genitalia. If there's not, I'm going to move on. I'm going to use circumferential palpation of her leg, looking for tenderness, crepitus, swelling, or deformity. I'm going to feel for her pedal pulse. What toe am I touching?
The big one.
What toe am I touching?
The tiny.
Would you wiggle your toes, please? Wiggle your toes. Okay. And repeat. Okay. Toe,
The big one.
toe.
The tiny one.
Wiggle your toes, please. Okay. Radial pulse. What finger am I touching?
The big one.
The finger?
The tiny.
Squeeze my finger. Okay. If you can reach over, if you're tall enough to reach over, fine. If you're not, go around to the other side. Don't fall on the patient trying to reach over the patient. Okay? What toe am I touching?
The big one.
What finger am I touching? What finger am I touching?
The tiny.
Squeeze my fingers. Okay. All right. Now we're going to do a log roll. I put her on the backboard and inspect her back. So you're going to do the count on your 3 count.
All right, 3, 2, 1, roll.
Okay. So now I find her spine and I walk her spine. So I feel each spine is processed all the way down. Okay, I check her upper back, I check her lower back, I check her butt. Backboard's in place. 1, 2, 3, back.
1, 2, 3, roll.
And the exam is complete.